Welcome. This is the Dentist News Network. I'm Scott Drake. Bruxism, also known as night grinding, is a common problem with many people. In fact, many people have it and don't even know it. My guest is Dr. Bradley Briggs with Briggs Family Dentistry in Scottsdale, Arizona. Dr. Briggs, welcome back.
Hello.
All right, let's begin. What exactly is bruxism?
Well, every one of my patients does some form of grinding or of bruxism. And one of the most common things that I hear day to day when I look in someone's mouth and we see some of the wear patterns and teeth that are starting to wear out because of them grinding, everyone says, I don't do that. My wife doesn't hear it. I don't think I do any grinding in my sleep.
Okay, then with all that grinding going on, how long does it take for teeth to be adversely affected?
Well, research shows that everyone grinds their teeth to some degree. There are people who don't do much damage to teeth, and there are people that do quite a bit of damage. It's been shown that in your sleep you can create up to 5 times as much force as being awake. So if you're clenching down as hard as you can, in your sleep you can do that 5 times harder. Oftentimes I'll see patients that come in and have teeth that are sensitive, and we'll take x-rays and look, and we can't find anything wrong. There's no abscess, it doesn't need a root canal, and simply putting force on teeth can cause that tooth to become sensitive.
Dr. Briggs, among other things, the structure of the face looks like it would be adversely affected after a period of bruxism.
One of the things that I see on a weekly basis is someone who, as you grind your teeth, the upper and lower teeth get shorter, the distance between the top of the tooth and the gum. So people actually will wear out all of their teeth, and we can't just fix 1 or 2 of them. To solve the problem, you end up having to do major reconstruction, where we work on all the teeth in their mouth to open the distance between their nose and their chin. As you grind your teeth, that gets closer and closer together, and we have to do quite a bit of work to get them back to health.
Dr. Briggs, can you talk about how night grinding can be associated with some sleep disorders?
Yeah, they are finding oftentimes that bruxism is associated with sleep disorders such as sleep apnea. And that's not necessarily restricted to one age group. We're finding that with children they might have an obstructed airway from tonsils, and that they are having sleep apnea, and that is often diagnosed by first noticing that they're grinding their teeth at night.
Well, I think the good news in all of this is that there are some simple treatments available, right?
One of the things that dentists offer to patients are night guards, which doesn't stop the bruxism, but it prevents the damage to the teeth. And wearing a night guard, oftentimes patients think that it's some bulky big mouthpiece that they have to put in, and it can be as simple as a little flat-planed guard that just clicks on the biting surface of the teeth. And that prevents you from being able to clench down and do the damage that occurs at night.
Thank you, Dr. Briggs.
Thank you for having me.
My guest has been Dr. Bradley Briggs with Briggs Family Dentistry in Scottsdale, Arizona, here on the Dentist News Network.